what she will talk to us about today. So please welcome Lori Byron.
Too embarrassing. Well, thank you all for being here. And thank my husband for doing a lot of thankless tasks in the background, like being the IT person today. You all hear okay? So when Rob and I talk to students, whether it's high school or college or nursing medical students, or even to general public groups, we often ask people what's their most concerning information that they heard that they hadn't heard before. And to a T, it's always the issues related to maternal fetal health. So I'd like to go over a few of the things that affect our pregnant women and their fetuses, including poor air quality, health, and drought, and look at some of the unique vulnerabilities, and then also discuss some of the risk reduction strategies that we can do and highlight some resources. So I'd like to acknowledge that I continue to inhabit the unsurrendered lands of the Apsalica people who have been stewards of this land for thousands of years. And I'm indebted to the Crow and the Northern Cheyenne for the openness and trust they placed in me, working with them for 27 years. So Rob and I spent most of our careers on the Crow Reservation and practicing pediatrics for me and internal medicine for him, but also doing a lot of public health. But it wasn't until our kids went off to college and we had a little more time to breathe and read that we started looking at the data related to helping climate change. This was 12, 15 years ago. And we were absolutely shocked. I said it's an epiphany, and Rob says it's an oh crap moment. And we decided that if we didn't do some work outside the exam room, what we did inside the exam room wasn't going to matter. And so we aren't the only radical people in healthcare that feel that, because in 2022, the American Medical Association adopted a policy declaring climate change as a public health crisis. And for those of you in healthcare fields, you probably know that AMA is a fairly stodgy and quite conservative organization. So the pediatricians and the obstetricians have had a lot to say about this too. The American Academy of Pediatrics was the first society to have a policy starting back in 2005. And in their policy, they talk a lot about what we should be doing as clinicians, as nonprofits, as cities and towns, and government officials. The ACOG statement came out about 10 years ago, and they mostly focus on what the government should be doing. So we have these vulnerable populations, and everybody that does anything in climate change has heard of them before. But quite honestly, if you look at this list, a number of us in this room would fall into one of the categories, and certainly the majority of the people in Montana fall into these categories. And depending on what category you are, you're vulnerable for different reasons, but they're all vulnerable populations. I would like to point out at the beginning that with the exception of sea level rise, climate change is a threat multiplier. It's not the only cause of hurricanes and droughts, extreme weather, war, famine, economic downturns. It's not the only cause of health issues like heart attacks, strokes, preterm birth, dementia, diabetes, malnutrition, and increased food prices. But it does include increase the risks of these events or worsen these conditions. So let's start before babies are even conceived. Infertility has a lot of association with air pollution. There's been 3 really big studies around the world. The main one was done with the Oxford Nurses Study, and they looked at how far nurses lived away from major interstates. And they looked at infertility rates. Primary infertility is when you've never been able to get pregnant, and secondary is when you have been pregnant before, but you can't get pregnant again. And they found a significant association with the closer you live to the interstates, the higher your infertility rates. And then in California, they did a fantastic study 6 or 8 years ago. There was about 8 oil and gas fired power plants, and about half of them were going to be decommissioned. So they had the before and after data on all of these plants. And what they looked at again is how far people lived away from these plants. And so, but the post data, the reason it was so good is because they still had some of the plants that were open, and the rates didn't change from the earlier years to the later years with the people that lived near open plants. But where the plants had closed, they had a significant improvement in fertility. So let's look at air pollution first. Well, healthcare providers honestly are, maybe we're a little behind the ball because we should have known a long time ago that air pollution really affects babies. Because we've known for decades that cigarette smoke increases crib deaths, increases preterm birth and all kinds of other complications. It turns out that fetuses are incredibly sensitive to any kind of air pollution that their moms breathe. So it can be dust and drought conditions, it can be forest fires, it can be oil and coal fired power plants, and it can be the exhaust from our cars. And the reason I think is summed up in this slide, which I love, the particles are drawn to scale and the red blood cell is generally 6 to 8 microns across. And you can see the PM10, which means it's 10 microns across, the particulate matter. And so it's quite a bit bigger than a red blood cell. PM2.5 is quite a bit smaller. And then you see down into viruses and bacteria. PM1 and PM0.1, of course, are way smaller. Well, red blood cells normally live in our bloodstream, but not always. They can sneak out between cells and they can get anywhere in our body. So these small particles can do the same thing. They can get out into our body. The other thing that this slide doesn't show is that these particles are actually very biologically active. Sometimes they have volatile organic compounds, sometimes they have heavy metals, sometimes they have viruses on them. So the body really doesn't like it when they are in the body. And so this is just a depiction that the PM10, those big molecules that you saw, pretty much stay in the upper airways. In 2.5 down to 2.1, get down into the very outer edges of our lungs, and then the PM 0.1 gets everywhere. And in fact, so it was found on the fetal side of the placenta for the first time in 2018. We thought that the placenta was sort of a protective barrier against almost everything, but we were quite wrong. So substances that are in our body that are not of our body are called foreign bodies. And what they cause our own body to do is to set up a reaction called oxidative stress. And oxidative stress causes almost everything bad you can have in your body, except infectious disease. So over at 9 o'clock, you can see that oxidative stress affects our fetuses, which we're going to go into. So an environmental pediatrician a couple of years ago looked at air pollution in preterm birth and with modeling studies showed that about 3.3% of our preterm births in America are due to PM2.5. That's about 16,000 premature babies a year. And he estimated it was about $5 billion in cost to society. Around the world, it's actually a lot more. Air pollution causes 20% of newborn deaths a year, or 500,000 deaths across the world. And if you look at this map, you can see we're not the worst, but we're not the best either. So we're in that kind of lightish green, but the people in the teal or the purples actually have better air quality and less percentages of preterm birth because of air pollution. So those same researchers in California that took advantage of the decommissioning of the power plants, they also looked at preterm birth. And again, they had the pre and the post for the plants that opened and that stayed open and the plants that closed. They found that the plants that closed, that the people that lived close had a 27% reduction in preterm birth, which is a huge number in medical literature. So a couple colleagues of ours, a pediatrician named Susan Pacheco and a obstetrician named Bruce Picard, did a systematic review back in 2020. And when they sent this kind of to be looked at by some of their colleagues, the thing that shocked me wasn't at all what they found, what their results were. What shocked me were how many studies they went through. They started out with 1,800 studies. They just wanted studies from the United States. They ended up with 74 studies, which to me was just amazing that there were 74 studies looking at pregnancy and its effects of air pollution and heat, sorry. And when you look at combined total, these studies represented like 32 million births. So these were, by doing a systematic review, these were huge numbers. So looking at what's in the box on the top of this is what their results were related to air pollution. And so they found that with most of the studies, there was increases in preterm birth, in low birth weight, and in stillbirths, babies born dead, when you are exposed to air pollution. It's really hard to look at data on research on pregnant women, especially related to something as ethereal as air pollution. Sometimes they're looking at, wait, that's related to heat. We'll go back to that. So there's been other issues associated with air pollution and lots of varied studies, but again, they're done in different ways. So some of them are looking at particulate matter, some are looking at ozone, some are looking at polycyclic aromatic hydrocarbons, some are looking at where you work or where you go to school or where you live, usually where you live. So there's been associations with intrauterine growth retardation, and that's especially in the first trimester, which makes sense. And it's especially associated with PAHs. And for those of you who forgot what we learned back in chemistry, PAHs, or polycyclic aromatic hydrocarbons, are what happens when we incompletely combust fossil fuels, which is pretty much every time we burn fossil fuels. It's incompletely combusted, and we end up with these PAHs. Thyroid disruption has been associated with particulate matter breathed by the mother. Sudden unexplained infant deaths, that's a new name for what used to be crib deaths or SIDS deaths, seems to be linked to prenatal particulate matter and ozone, especially just prior to delivery. And stillbirth and miscarriages linked to ozone and traffic pollution, and premature birth is linked to particulate matter. Even more concerning, though, is that it's becoming more and more research is happening linking neurodevelopmental issues with the breathing of bad air by pregnant moms. So there's been a number of studies, enough studies that there's actually now meta-analyses, which means there's a good number of studies out there, but pretty much the majority of them are showing differences in learning abilities, lowering of IQ, possibly autism, and attention deficit hyperactivity disorder. That's just from the mom breathing bad air. And then schizophrenia and autism, there's been a number of studies linking both mothers breathing it, but also early childhood exposure to particulate matter. Air pollution indoors and out causes asthma exacerbation, but it actually causes asthma in children. So some of you may have been keeping up in the last 5 years or so when we've been talking about the problems with gas cooking stoves in our house. And they actually think that about 10% of childhood asthma is caused by living in homes with gas burning stoves. Exposure to air pollution is also linked to obesity and type 2 diabetes, probably because of that oxidative stress that we talked about before. So we don't have a whole lot of fracking in Montana. Most of the research is done in Pennsylvania because they both have a lot of fracking and they have a lot of people. And they've shown pretty strong associations with low birth weight the closer you are to infrastructure related to hydraulic fracturing. But we do have wildfires in Montana. So this is an excerpt from the 5th National Climate Assessment, which was a year or two ago. And they looked at the statistics over the last several decades and found that the wildfires in the Northern Plains, of which we are a part, has increased by almost 890%, which is a lot. So the American Lung Association puts out their State of the Air report every year. Missoula was the 10th dirtiest city in the United States in 2020, and they were the 17th dirtiest last year. So a lot of particulate matter in Missoula. There's actually only 12 counties in Montana that measure particulate matter and report on it. And of those 12 counties, 11 received an F score and 1 received a C score. It's only been in the last couple of years that people have actually linked wildfire to preterm birth. Because again, wildfire, it may happen for a week or it may happen for a month. It's kind of hard to measure. You got to be in an area where there's a whole lot of people and a whole lot of fire. So this study was from 2023 in California. I was on the EPA Child Health Advisory Committee a couple of years ago, and we got to review this report before it came out in 2023, I think, climate change and children's health. And they called out 2 states, Montana and Wyoming, that we were projected to experience some of the highest rates of health effects from wildfire smoke on children. So moving on to heat. We all have really good memories of heat. We think about our gardens and our vegetables and our flowers. We think about playing sports in the summer. We think about laying on the beach. Or don't think about skin cancer. And then we think about cute little babies in blankets and hats. It just doesn't seem like a degree to it can make all that much difference. And it was years into our working full-time on climate change that I first saw this bell curve and had a epiphany that this is why it makes so much difference. So if you move that temperature bell curve over to the right just a little bit, what it means is that your little small triangle in the bottom of kind of lighter color red, which was hot weather, we have a whole lot more hot weather. And then the extreme hot weather is something that we've almost practically never had before. So this little bit of temperature really does make a difference. When the Climate Change and Human Health Report came out a few years ago, and you have several of the authors in the room today, we looked at heat in Montana and pretty much everything east of Bozeman and then heading up north. We're looking at seeing 35 more days over 90 degrees by mid-century, and that's not that far away. So when women are pregnant and they're exposed to heat, we have more prematurity, we have more intrauterine growth retardation, we have stillbirth and more birth defects. So back to the CARS study, the bottom box that's highlighted now on heat, all of the studies that they found increases in stillbirth and low birth weight, and 4 out of 5 studies have showed an increase in preterm birth related to heat. When these studies were done, they weren't looking at heat domes like the 115 degree weather out in Seattle. They're looking usually at 3 or 5 or 7 days during a certain part of the pregnancy, typically the 2nd or 3rd trimester. So, pretty normal amounts of heat, but heat is not helpful. So if we look at children, about 12% of our ER visits by children in the US during the summer months are due to excessive heat. And so kids, especially babies, the younger kids, are among the most vulnerable to heat-associated illnesses. So when you're young, you actually can't regulate your core body temperature, and that's why they tell you no babies in hot tubs when you go to hotels. They sweat less, they acclimate more slowly to heat. And the older kids, they can actually, they acclimate okay, but we know how teenagers are. They don't really listen to us. They don't listen to their bodies. They do listen to their coaches. So you find a lot of older kids that get in trouble with heat, again, because they aren't listening to the fact that they feel really bad, that they want to win the football game on Friday, so they go ahead and keep working out in heat. Another thing that affects human health is our income. So a livable wage is actually one of the most important social determinants of health. And the Lancet Commission, the Lancet Countdown on Health and Climate Change, comes out every year. They do a yearly, a worldly report, and then they do one for the US. And each year they focus on a different subject. So in 24, they focused on the fact that we have a lot of hours of lost work because of heat exposure. And this affects families, it affects moms and babies, because if you are of the kind of laborer that is not getting paid when it's too hot out, then you are losing income, and that's affecting your mental health. Heat also affects our brains. Our concentration is worse with heat, and that's been researched in K-12 schools and also in universities and also on the job. Heat can make people more depressed and more irritable, and it increases all forms of aggression. So suicide, altercations, murders, spouse abuse, and child abuse are all increased when the weather's hotter. Back to the study by the EPA, they called out 7 states when looking at 4 degrees of warming. And the 7 states that we're going to meet have the highest projected learning losses for their children. And this is in part due to lack of air conditioning, but we were one of those 7 states. So a report came out in 2024 looking at schools across the United States, and on average, they were just 10 years ago, they were just closed 3-4 days for heat, and now they're closed 6 to 7 days for heat every school year. And that's actually a lot of decreased learning for our students. And like almost everything else in climate change, those effects are disproportionate. So there's been a number of research studies done looking at urban and how it affects the vulnerable and the lower income population more than it does in the wealthier suburbs and wealthier parts of the cities. So looking at extreme weather, we have some effects on women and fetuses and children that are specific also. I love this slide because it reminds me every time I see it. It was a Montana storm. It's a great picture. But when we have more moisture in the atmosphere, like we do when it's warmer, so for every degree centigrade warmer, we have 7% more moisture in the air. And any one storm will draw moisture from the air for 1,000 kilometers surrounding. So it really doesn't take a whole lot of moisture in the air to make the weather events a whole lot more extreme at times. So women represent 80% of the people who are displaced by extreme weather. And we see increased gender-based violence during and after such emergencies. And the next one I put in italics, and this is because this is just a warning to all of us. Women are 14 times more likely to die in a climate change related disaster than men. And if you Google that on your phone right now, you'll find at least 100 news sources that quote this statistic. But it actually came from one reporter at one emergency situation in the world. And it was just kind of picked up by the press, and everybody quotes this now. Women are more likely to die in climate-related disasters, and part of it is because of our cultural norms, because women are more likely to be at home, they're more likely to be caring for children, they're less likely to hear emergency warning systems because they're in their home and not downtown at work. But it really isn't a very good statistic. So then we have some of these collateral damage sorts of things that happen with our extreme weather also. So with Hurricane Harvey, which was in 2017, the governor of Texas decided to just forget about regulation of air pollution for the 3 to 6 months after Hurricane Harvey. And millions of pounds of unregulated air pollution was allowed out that normally wouldn't have been allowed out. And then there were dozens of tons of just chemical sludge, basically from industrial areas of Houston that flooded. And of course, the areas nearest to these industrial complexes are lower income people. And so now their streets, their homes, their yards, everything else has been contaminated with, who knows what kinds of chemicals. So extreme weather events also affect our agricultural industry, and that affects two things. One, it affects the people who are actually affected by the situation, but it also affects the rest of society because food prices go up. So in 2020, there were 20 million acres in Iowa that couldn't be planted because it was flooded for such a long period of time. And that was actually about 2 to 3% of our farmland in the United States that year that couldn't be planted. And then in eastern Montana in 2019, we had a stage D4 drought. I didn't even know that droughts had numbers to them. The D4 is the worst. And this is the first time we'd ever had a D4 drought in Montana. And about 1/4 of the crops that normally would have been produced in eastern Montana, their crop production went down by about 25%. So again, a huge hit to the families, but also a hit just to society because of food prices. And so if we look at poverty rates in the United States, poverty rates are pretty much always higher for women, and they are highest in the women of childbearing age. So these increases in food prices really do make a difference in what the women and the children are eating. And this is just a reminder. I actually specifically use this data from 2014 because prices have changed and fluctuated so much since COVID. But I suspect that the rough statistics for the world are about the same as far as comparing one country to another. But we spend less on our food per household income than any country in the world at 6.5%. And if you look at Europe, they're spending double what we spend. Other countries are spending triple or quadruple, and some countries are spending half of their take-home income on their food. So if it's affecting lower income people in the United States, it's affecting people around the world even more. Another thing about our crop that affects pregnant women is because of what's happening related to CO2. Now, we all learned back in Biology 101 that plants like CO2 and they grow better, and they do. But what we didn't know way back when I was in school, because nobody was researching it, was that these plants that grow better actually end up with having more carbohydrates in them and less protein and less of the micronutrients. And they've done these studies in hundreds of species of plants in hundreds of locations in the world. And it's always consistently 3-4% less micronutrients and protein. And this is really important when you're pregnant. Poor diets are linked to a number of different problems, both for the mother and for the babies. And again, you might think, well, this is in other countries, we're all well nourished here. But even in America, 50% of our women are iron deficient during their pregnancies, and 12% are affected by iron deficiency anemia. So it does make a difference. Another issue related to extreme weather is that of drought. And in drought, women and children have to walk farther to get water when you're living in lower and middle income countries. So the typical lower income country, people walk 3-4 miles a day, carry 5 gallons of water. And it's almost always done by the women and the girls, it's occasionally by young boys, but generally by girls. And so what they found is that in times of drought, women are having to walk farther, the girls are having to walk farther, they're less likely to go to school. And in fact, there's been a couple nonprofits that have studied this. They put in freshwater supplies in towns where women were having to walk a couple hours, and they actually found significant improvement in the percentage of girls that went to school. So a couple miscellaneous effects with women and children. First of all, Bangladesh, as most of you know, is one of the countries with maybe close to the most amount of land that's at sea level of any country in the world, except maybe the island countries. And so they've had huge issues with sea level rise. And the sea level rise has affected their water supplies. And so the water supplies are more salinic than they used to be. So over the last 20 years, people have been researching this related to maternal health, because when women are pregnant, they can develop high blood pressure, and they can develop something called preeclampsia and eclampsia, which are both dangerous and potentially deadly to both the mom and the baby. And they, in fact, have found this problem to be increased in Bangladesh. And again, we might think, well, that just happened somewhere else. Well, in Iowa City, Iowa, just a couple of years ago, they reported that they were having higher sodium concentrations in their municipal drinking water, and they actually found increased risk of preeclampsia. So when we look at our coastal cities, like the whole state of Florida, especially areas where it's low-lying land on the coast, our water supplies are being increasingly infiltrated by more salinic water, which can affect the health of women and affect other people in relation to hypertension. So another issue related to extreme weather and sea level rise is dislocation. So in Alaska, we have 30 villages that are at risk, a dozen that are sort of looking like this, where people are needing to be relocated. Most of these are indigenous communities. So these are people that already have the historical trauma of forced relocation, and now they're going to be forced to have to move again, which is hard for anybody. But from what my indigenous colleagues tell me, much harder when you're a place-based person. And I certainly believe that. The Biloxi Chippewa
in Louisiana
the first
from the
United States, he moved, and you had
they lived on islands in the Gulf of Mexico, and their land is now 98% underwater, and the state of Louisiana bought them land 100 miles inland. So again, not only are they having to move, but they have been fishermen for thousands of years, and now there's no fish, there's no fishing. Their whole way of life has been disrupted. Drag it across, like where?
Can you still see it?
Yeah.
We've got Rob coming. There.
Oh, this way.
He's as God said, in many ways. So our Department of Defense, the Pentagon, the leaders of our military branches have been concerned about, issues related to climate change for a long, long time. We have 1,700 military installations that are, having difficulties because of sea level rise. But also the, military experts know that, climate change is affecting national security because it's increasing the risk of global war, both within countries and beyond countries' borders. And this has an effect on our women and children. So during times of war, the mortality rate for women triples. The malnutrition in women and children increases significantly. Many are left widowed and orphaned, and we have a lot of increase of sexual violence. So we're going to move on to funner topics because that was all kind of depressing. So we'd like to look at some interventions. So over the last 5 to 10 years, we've seen human health kind of replace the polar bear as the new base of climate change. And I think that's been really good for 2 reasons. One is because healthcare professionals still are, according to the Gallup polls, the most trusted professionals in America, with nurses being #1 for 25 years or so and running. We have captive audiences, so, you know, people very rarely walk out of the exam room when we're talking to them, or the hospital room when they're stuck in a bed and they can't leave the room. So we really do have these captive audiences, and we have private audiences. So if you look especially at lower income families, there are very few professional people that they have any encounter with until their kids go to school. And so we really do have access to the entire spectrum of the population as healthcare workers. But the other great thing about healthcare data is, for the probably half of you in this room who are not healthcare providers, what we found more and more over the last decade is that people who are doing any kind of climate work or greenhouse gas reduction work are using health data because it's more effective in their work. So looking at economic data and looking at health data is really helpful in convincing society to make changes. So the people that did the systematic review earlier, Bakar and Pacheco, this was their recommendations in clinical counseling regarding air quality to pregnant women. And they advised talking to them about the air quality index, and we'll go a little more into this, talking to them also about their indoor air quality related to gas stoves and wood burning stoves and smoking cessation, because all air pollution is bad and it's all cumulative, and considering talking about home air filtration. And then with heat, they recommended looking at the heat index, tailoring hydration counseling. They recommended that labor and delivery units should be thinking about how many people they have on shift when they're having hot weather out, and also looking at home air conditioning and cooling. So most of our patients and most people in general are unaware that heat and air quality it can affect them, especially healthy people, like young healthy people like pregnant women. But a lot of older people aren't aware that there's a lot of increase in strokes and heart attacks when it's hot out, or when there's poor air quality out. So this is something we can do as providers. You don't even have to mention climate change if you don't want to. Just talk about the heat and talk about air quality. As of a week ago, this was still on the CDC site. They had some recommendations on protecting children, but the bottom one I thought was the most ironic that it was still there. They said the most impactful action to slow the rate of warming and ensure a safer future for a younger generation is a commitment to rapid and sustained reductions in carbon pollution. So there's a few things that people are doing around the state. Some of it's from our organization, but some of it's from other groups. One is that we've really tried to get the air quality flags into schools and clinics and fire departments and any place that will fly them across Montana. We have 75 sites now that fly them. And if you're in an area that doesn't have a local weather station, we can provide a purple air monitor. And it's a way for the community to see that this matters. People come in and ask the secretary of the school, why is this flag yellow today at the school? What's this about? So it's just an easy way to do community awareness. Most of us have seen this chart. I think it was really fantastic. A few years ago, the Montana High School Sports Association actually started using this chart in saying that they weren't going to practice when the air was orange, which is what for children and for people at risk is the category that you shouldn't be doing vigorous exercise outside. I know they don't always obey it, but I know that actually a reasonable amount of time they do. A question that you can ask in your children, your grandchildren's schools, in daycares, are they actually going by this chart? Because they should be. The other thing you can do if you're in activism work is this little widget you can get at airnow.gov, and you can put it on your website, and then it just changes every day with the air quality in your area. We have one on our air quality flag page on our website. So airnow.gov is great because they have that little app you can put on your smartwatch or your smartphone. But it works if you live near a weather station. But for the Gravers back there, and for Rob and I and Hart and Red Lodge, we're both 60 miles away from a weather station. So really what is showing on here now isn't all that accurate. And that's because we only have about 20 official weather stations in Montana from that top map. But if you go to fire.airnow.gov, which does not have an app, it shows you all the purple air monitors across the state. So it's much more accurate if you're living in a rural area. There's been some great recognition events that have gone on in Montana, especially with Missoula, doing wildfire smoke ready weeks and educating the public. It's important to know that if you are going out in wildfire smoke, the little cheap masks really aren't doing you any good, and you need to have a well-fitting N95 mask. I'm sure Elisa can give us advice on how they should be fitting to prevent both infectious disease and exposure to wildfire smoke. And then HEPA filters in our house do help. So if you have an HVAC system and you have the right kind of filters, they help your house. But a lot of houses don't have that, and a lot of people can't afford that. Just small HEPA filters will help in your house, but they do, they cost a couple $100, so that's an issue when you're on a fixed income. So there's a number of places in Montana that have identified clean air centers or cooling centers for times when we have either extreme heat or extreme wildfire smoke. The clean air centers are actually the harder ones to find because a lot of big buildings that look like they'd be room to have a lot of people in don't have clean air, and that includes most of our public schools. There's also been a lot of box fan filters. There's been research done here in Montana. I think Dr. Gilkey's students over in Montana Tech have done research on this. It really does work in your home. It helps get rid of a lot of the air pollution. If you have a home that's not too leaky, again, low quality homes, sometimes they're so leaky the air is as bad outside as it is inside. So it doesn't have as much effect. There's been a number of nonprofits in Montana, the School of Pharmacy and the University of Montana, and some of the nonprofits and health groups have given out air HEPA filters or box fan filters across the state, still only hitting a small percentage of the people, but it does make a difference. We have some lovely educational materials. There's some samples in the hall. We'll print it and send it to you for free that you can put in offices or public spaces. And we also have these really nice floor banners that are out there. We have a couple sets of them that rotate every couple months. They've mostly gone to healthcare facilities, but they can certainly go to universities or other places. We'll send them anywhere. There are text and web alerts and website alerts in a number of situations. So sometimes that's in medical facilities. Lots of clinics have text alert systems where you might notify people when their immunizations are due. And those systems can be set up. So you could target all the women that are pregnant, or you could target all the elderly people and send out a message when you know there's going to be dangerous heat or dangerous smoke. And if your university or your public school has daily reports, a lot of them do, related to the student body, consider getting it on their website that they actually look at these sort of things, or that they put that air now widget on. And then one of the best things we could do is checking up on our neighbors. And it sounds kind of silly, but there are a lot of people that are differently abled, that are less able to get away, that are unaware of the fact that, yeah, it's hot and I'm toughing it out, but maybe that's not good when you're 80 years old and you're at risk of a heart attack. So just check on these people.
Where you're 80 years.
two different ways we can work on our public buildings, both in healthcare, but also other kind of office spaces that we live in. The Energy Star certification from EPA as of yesterday still exists, and it's a really good program. And they work a lot with churches and businesses, the stores, offices. And then there's one called mygreen.org, and they're both free. And they can really help us with our greenhouse gas emissions from where we work. And so the bottom line is, anything that we do to lower greenhouse gas emissions improves human health. Because when we lower the greenhouse gas emitting pollutants, we also lower the air pollutants that are dangerous to human health. But there's tends to be actually a lot of additional effects that help. And so when we look at sustainable agriculture, just eating that food is healthier for us. When we plant trees, it improves our mental and physical health. When we increase public transportation and walking and biking, we improve physical health and lower greenhouse gas emissions. So I think there's a lot of things that we can do. I think we can, that our action empowers both us and our patients and our communities when you're not in healthcare. So that's all I have.
I love it.
What questions y'all have for Dr. Byron? Go ahead.
I'm just wondering if there's any research being done on specifically the, link between. I'm just wondering if there's any research being done specifically on the link between higher, climate change and the CO2 levels and everything, and lung development in children and fetuses and the survival being formed, and if there's any changes there.
I have not heard of it, but I'm not an academician. Anybody else in this room? Good question. And since you're in medical school, maybe that'll be one of the things you research.
Go ahead. Julie, over to
You said that if you said that in extreme weather women are 80% more likely to be homeless than men, and I was wondering why that was.
I think some of it's related to socioeconomic status. So when you're in a single family or a single parent home, it's more commonly the woman, again, not always, but more commonly. And again, just because of having to rescue children, they just tend to be more at higher risk. Even in rural areas, they tend to be living more than the men are who might be living in the city to have a job as while the women are at home.
Good question.
I think this is about natural science.
I had a lung infection about several decades ago with diagnosis of fungus Aspergillus flavus that one of the doctors here thinks is more widespread, but it comes from dust, and I got extremely sensitive to a variety of dust, including the fungus dust. And what I found is that if I'm in a place and there's a lot of crap I can't handle in the atmosphere, a simple box fan, and like you were showing on that video, that's really, really important. I think that providers do give people access to pure air, even if they have a house that they can only close one bedroom door to have a place to be where the air is clean, even if their house is drafty. That's so, maybe I'm not asking a question, except maybe, what are the ways that are cheap and inexpensive, a box fan and a HEPA filter? That's the what's the M14, I forgot the M number, that's really good. I got a bunch of them in my house, and I have a whole house fan now to keep this thing from coming back to me, but I don't think I'd be alive today if it wouldn't be for that diagnosis and a whole bunch of anti-fungus medication that I took. So I'm breathing now. Thank you.
I think just real quickly for the question, there's a good point I want to follow up. And that's how can we ask our primary providers to talk about clean air? My experience as a ER nurse for 14 years is many providers don't have the time and they don't. So we hold conferences like this. So those going into med school, those who go to your doctor, if we can ask them to have that conversation more often. I don't think it happens often enough, and I don't think it happens in time to prevent the disease process.
Hey, Lori, we always talk about the box fans for, air pollution, but it seems like people are using those box fans when it's really hot. And most of our homes in Montana don't have air conditioning. So how do you resolve that? You have them open it up at night a little bit to get some cool air in your house.
Oh, you mean they're opening their windows to get in clean air,
No, they're opening their windows to get in.
to get cooler?
Cool.
Yeah, right.
And so if you have your box fan, it doesn't, you're gonna melt. Cause you know, it's usually wildfire smoke and it's the summer and.
Yes,
How do you
you're
resolve-
kind of screwed if you have to open your windows and it's during wildfire smoke season and it's also very hot. I guess you're kind of playing the odds. I mean, I think having any kind of filtration in your house, you would still be helping to get it out some. You know, whether you had an HVAC system on or you were using a box fan filter, for the purpose of getting it out, but you're also letting it in. So yeah, it's a 6-1 half year, go into another place is quite honestly probably the safer thing to do.
Thank you. I wondered if this is more of a pediatric question than a mental health, but, could you speak to a moment of what you're seeing or learning about mental health in adolescents related to climate?
I think some people in this room can probably speak better than I can on it. I mean, we know that, you know, the vast majority of young people in America and around the world are very concerned about climate change. And I think it's around half of our youth that are considering not having children because of it. I know my personal experience is that I've worked in the ER the last 10 years, night shifts, and it's almost impossible to have a night shift that I don't admit at least one suicidal kid. So these are generally kids 18 and under. And occasionally it's from short-term things like being bullied or somebody breaking up with somebody. But a lot of times when you actually sit down and talk with them, it's because of the state of the world, climate change, the environment. So from my personal experience, you know, it's definitely out there. Would anyone else like to address that of our mental health people here?
Any other questions or comments?
I really liked the question about indoor air quality, especially when it comes to heat and wildfire smoke in Montana. And I can't speak for everyone, but I know at least in Butte, when I lived a summer, it was something I really struggled with was being able to have clean air because, you know, living in a dorm without any sort of air conditioning, but also having to keep those windows open at night. I guess my question is, how can we urge our communities, our campuses, and all of our networks around us to really stress the importance of indoor air quality, especially in relation to health and climate change?
I think some of you in academics can hopefully support this, but you know, what we found is students have more power than faculty do in a lot of these situations. So students demanding that something be done, you know, getting a petition, getting you know, a few hundred kids to sign it, not kids, sorry, adults in college, to sign it. I mean, we found in medical schools, the most effective way to get climate change into the curriculum is for the students to request it. So you really do have a lot of power as students. I don't know if anybody's here from the Climate Coalition here at MSU, but I know those of you from UM are very involved in this. You know, get people complaining. That's what activism is all about.
Lori, there's also a question in the chat. Does whether Medicare, Medicaid, or private insurance covers air purifiers for homes?
They do in some states, they do in Oregon, and probably other states, you might know because of Providence.
Oregon's the only one of Providence.
Okay. Yeah, so
I do know that Northwestern Energy had some discount coupons for people to get HEPA filters. They run out. But I know that
Climate Smart Missoula was helping remind people that they could ask for discounts on some of those filters through Northwestern Energy.
Those are rebates, so you have to buy it outright, apply for the rebate, and then Northwestern will give you a reimbursement, just so. They're still out there.
So McKenna is with the Montana Renewable Energy Association, if you have any questions along those lines, while she's here today. It is a great project to do for like a community service project is, you know, go to a couple businesses in town, get them to give you some money and do like a box fan filter thing. They did a box fan filter day with Climate Smart Missoula. We're gonna do it with the AHEC students this summer. Those are the high school students that are going into healthcare and they have camps in the summer. And so Julia's gonna talk about air pollution